New parent, umbilical cord look fragile and you don't know what to do with that and you are so worried. I'm Dr. Sana, general practitioner, explain you how you can take care of it stepwise and heal your baby umbilical cord stump fast and safe. Subscribe my channel before going to the topic. Keep it clean and dry. Yes, you have to keep your baby umbilical cord stump clean and dry. Avoid soaking it into the water unless it naturally fall off. It takes usually 1 to 2 weeks to fall down. You can gently clean it with the damp cloth if needed, but more good if you clean it with the spirit swab. Don't rub it and don't use the soap on it. Number 2 is avoid covering it completely. Yes, you have to avoid the diapers on it. Keep the fold of the diaper below the stump and keep air flowing and avoid irritation. Avoid tight cloth or diapers touch the stump directly. Step 3, watch for the sign of infection. This is the most important step. Keep eyes on baby umbilical cord stump. And if you found any sign like redness, swelling, foul smelling, yellowish discharge, it can be sign of infection. And if baby developed the fever, you go to the doctor immediately near you. Step number 4, don't pull it or don't remove it. Never pull the baby umbilical cord stump yourself. It will fall off naturally, take 1 to 2 weeks. By pulling or by removing, you can cause infection or bleeding. One bonus tip for you: let the cord stump air as much as possible and give the sponge bath to your baby until it fall off. Taking care of your baby umbilical cord is simple. Follow these steps and you can do it. Subscribe my channel for more health tips.